I will start with our daily updates. We now have 3,409 confirmed cases of COVID-19 in Canada, and 688 of those cases are in Ontario. Chatham-Kent has 2 cases, and Sarnia-Lambton has reported 5 cases. The state of Michigan now has 2,294 cases, with 705 cases in Detroit. To date, we have 5 confirmed cases of COVID-19 in Windsor-Essex. Overall, 650 individuals have been tested for COVID-19, and of those tested, 453 tests are pending. These numbers reflect the total amount of testing done in our community, including Windsor Regional Hospital's COVID-19 Assessment Center at Olette campus. With increased capacity for testing at the Public Health Lab in London, it is anticipated that wait times will decrease. However, at this time, results are taking up to 7 days. Yesterday afternoon, the Ministry of Health released updated guidance for testing of COVID-19. Testing for COVID-19 should be based on clinical assessment. All specimens submitted will be tested. Where there are shortages of testing kits, then the following groups will be prioritized for testing: symptomatic healthcare workers and staff who work in healthcare facilities, symptomatic residents and staff in long-term care facilities and retirement homes, hospitalized patients admitted with respiratory symptoms, symptomatic members of remote, isolated, rural, and/or Indigenous communities, and symptomatic travelers identified at a point of entry to Canada. Please continue to visit our website, WECHU.org, for the most current information. Travelers who have traveled outside of Canada in the past 14 days are required to self-isolate for 14 days. Any returning traveler who presents with symptoms upon arrival in Canada will be placed under federal quarantine orders. If you have traveled outside of Canada and are feeling unwell and need to seek a health assessment for COVID-19, there are 3 options. Complete the online self-assessment tool available at ontario.ca, contact Telehealth Ontario, or call your primary health provider for a phone assessment or a virtual assessment if that is available. They will guide you for next steps, including contacting public health or attending an assessment center. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates regarding COVID-19.
Good morning, everyone. So we now have a 5th case, an increase from yesterday. This case is a male in his 30s with no international history of travel, but has recently traveled within Ontario. The case developed symptoms on March 15 and was tested in Toronto, where he is currently self-isolating and recovering with mild symptoms. Close contacts of the clients are being contacted by the Windsor-Essex County Health Unit staff and will be instructed to self-isolate and seek assessment and testing upon development of symptoms. As we are continuing to see an increase in the number of cases across Ontario, it will be a matter of time when we start to see community transmission happening in Windsor-Essex. I sound like a broken record, but the best thing you can still do for yourself, your family, and your community is to stay home and practice physical distancing as much as possible. Grocery stores, parks, picking up food, pharmacies, and any other areas, please maintain at least 2 meters distance from each other. When you are out in the public space, try to avoid touching any surfaces as best as you can. Wash hands frequently and often with warm water and soap, or use an alcohol-based hand sanitizer. I'm urging people to please follow these advice of our public health nurses. If they're asking you to self-isolate, it is absolutely important that you must self-isolate to protect your family and protect your community. Anyone who has gone to the assessment and testing center and was tested for COVID-19, they must self-isolate themselves until they get the results back. It is important for all of us because the individuals who are tested are probably deemed high risk by the healthcare provider, and they can potentially spread the COVID-19 disease in the community. And until we get their lab results back, they must self-isolate. I understand the need to test more people. It gives us a better indication of the current situation, but the measures that are currently in place will still be effective even if we have undetected cases in community transmission. That is why I'm urging you to again follow the public health recommendations. My colleagues in healthcare sector are getting ready to see an influx of COVID-19 cases and what they need to manage these individuals. Personal protective equipment is the first line of defense for these healthcare workers and first responders. They are doing their job, a very noble job, and putting themselves at a risk by managing these people. They need our help. They need our support in fighting this pandemic. There are many recommendations regarding personal protective equipment from various sources, and it is important that we are following the recommendations based on the evidence from reputable and credible sources. The Public Health Ontario has updated their infection prevention and control guidance based on the most up-to-date scientific evidence to respond to COVID-19 pandemic. We have to be careful and responsible when we're using this personal protective equipment. There is no requirement or need for individuals who have no respiratory symptoms or who are not at case to wear a mask. Masks are recommended for individuals who have respiratory symptoms to ensure the safety of the others. For those providing direct care for someone with COVID-19, it is recommended that gloves, procedure surgical mask, gown, and eye protection is wear. More details on the personal protective equipment recommendations can be found on our website. For proper use of masks, please see the World Health Organization website. Appropriate use of personal protective equipment and proper PPE stewardship is critical to fight against the COVID-19 and the protection of our healthcare worker and first responders. There have been a number of concerns related to the supply of PPE or personal protective equipment and potential shortages as the COVID-19 situation continues to evolve in our community, in the province, and across the globe. Personal protective equipment should be used only when recommended to ensure that those that need it the most, that is our healthcare workers and first responders, have the appropriate equipment when it is needed. Windsor Regional Hospital and municipal partners are currently collecting supplies, including donations for much needed personal protective equipment for distribution to healthcare workers and first responders. We are working with our partners to provide these masks, including homeless shelter, and we will be sending some of these gowns and masks to our healthcare provider as needed. All of us are in this together, and we must act together to prevent the spread of COVID-19 in our community. We have to practice physical distancing. We have to wash our hands with soap and water thoroughly and often. We have to follow the respiratory etiquette, coughing and sneezing into our sleeves or tissue. We have to keep our surfaces clean and disinfected. We have to keep our community safe and protected. Thank you.
We will now take questions from the media. We'll start with the Windsor Star.
Hi, Dr. Ahmed. Could you reiterate some of the details on the fifth positive case in the community?
So this man we just talked about is a male in his 30s with no international travel history. The person did travel outside of Windsor and Essex within Ontario, and is currently recovering and self-isolating and recovering with mild symptoms. We are getting in touch with all the contacts that this person came in contact with, and they will be notified based on the next steps with respect to self-isolation and any other investigation that is needed.
Any follow-up questions?
Yeah. Yesterday, Prime Minister Trudeau announced the Quarantine Act, mandatory self-isolation for international travelers. You previously commented that you were hoping for stronger restrictions at the border. What are your thoughts on the Quarantine Act?
So I think the people who are returning outside of Canada and seeing the federal measures, I think that's a good step. I think those individuals, they need to take those orders seriously and follow the strict requirement of self-isolation and monitoring their symptoms and reporting back to public health. So it's going in the good direction, right direction.
We'll take questions from CTV.
How much more concerned are you about community spread now that we have a case of travel within Ontario?
This has always been our concern, and we wanted to make sure that we have all those measures in place. The measures that are currently in place with respect to physical distancing, with respect to closure, with respect to having less interaction with more people that are not part of your family. I think those are some of the things that are needed. What we still need is to make sure that everybody's following that. This is not a problem just for Windsor-Essex. It is a problem for the entire province. It's a problem for the entire communities. It's a problem for the entire world. We all have to act together and at the same time. So even if we have strong measures in Windsor-Essex, but let's say outside of Windsor-Essex, there are no strong measures. So people who are coming and going, if we have different measures, it could create some of those challenges of still seeing the spread. So we are trying to make sure that all of this is happening at a consistent level, and the public health measures that are currently in place, if people follow that, we expect to see good results. And but it is important that people see that this is a threat to our community, and they have a role to play, and they have to follow some of those guidelines.
Question from AMA 100.
Dr. Ahmed, could you mention the dates again? When there was tested?
So this individual developed symptoms on March 15th and was tested in Toronto. And right now, he's currently self-isolating and recovering with mild symptoms. We were notified of the test results yesterday, and since then, our staff has been in contact to get all the contacts identified and provided with the appropriate instructions.
Any follow-up questions?
Is it Toronto? Does he live in Toronto or he lives in Windsor?
He lives in Windsor, but he has frequent travel history to Toronto, back and forth, and that's where he was tested in Toronto.
Okay, thank you.
Question from CBC.
Yeah, I was just wondering, around the Quarantine Act, is there anything more you can say about how that is being enforced locally?
So I think we're still waiting to get some of these details from the federal government, that how all this information would be translated back to our public health unit. The quarantine officers, when they are seeing some of these individuals, they will be providing them with their instructions, and if they are symptomatic, they will be asked to quarantine until they get out of the quarantine. For any traveler who has an extended travel, they will be if they are symptomatic, they will be placed in. They will not be allowed to board on another plane until they clear their symptoms. They are not allowed to travel and take any public transportation. But some of those details, I think we're still waiting to see through the official documents. So some of these details are still being finalized at this point.
And just as a follow-up, I think we've been hearing more and more that perhaps snowbirds, folks who are coming back from Florida or from the United States, aren't following all of the guidelines. Is that something that you are hearing about locally?
Well, we are getting complaints from pretty much everyone. Some concerns are valid, and some it would be hard to even confirm if these are the returning travelers. So we are trying to follow up as best as we can, and we are using a forum like this to re-emphasize the importance of people to self-isolate and even truly understanding what self-isolation means. And they should be following some of those directions to protect themselves, their family, and also to their community. So I think it is all our responsibility, and we should continue to hammer the same message again and again to everyone who is a returning traveler, to everyone who is symptomatic, to make sure that we are doing our part.
And any questions from windsorite.ca?
Just a follow-up on the 5th day, he was tested in Toronto. Is he self-isolating in Toronto, or is he actually in Windsor-Essex?
He's currently self-isolating in Toronto, but because he is a resident of Windsor-Essex, and that's why we are taking the lead in contacting all his contacts to make sure that we provide them with the advice to protect our community here.
Any follow-up questions? Any new questions from the media? Okay, thank you very much, everyone.
Thank you.
Oh, sorry, one more. Rob?
Just in regards to the testing, just in regards to the testing, After yesterday's news conference, we had people reach out to our radio station. I believe yesterday's test results came back, or they were tested on the 20th, correct me if I'm wrong. The individual that contacted us said they were tested on March 17th and they still didn't hear back. Is it odd that the ones that were tested earlier have not heard back yet?
So we have been told by Public Health Ontario that they do prioritize the testing. So it is likely that some people that haven't heard yet, that they will hear shortly, but we have received reports from people that are still waiting, and it has been a little while. With the increased lab capacity in London now, we hope that by next week, all results will get back to the person within a couple days. But right now, we do have cases that we're still waiting on.
Thank you.
Okay. Thank you, everyone.
Right, thank you, everyone.